Thanks, Mary. It's really a pleasure to be here today. And I'm so thrilled to convene this multi city group. We're all here today to share with you three different stories about our respected cities and the ways that we have each responded to the COVID pandemic around food insecurity by using data and digital tools at the community level. It's a super exciting conversation. Just three examples of, I'm sure, many across the nation that have been responding to this terrible double, triple pandemic in the ways they can. We have a lot to get through today, but what I'd like to first address is the recognition that, as we were hearing from the opening session today, that food insecurity is but a symptom of racial inequality and economic inequality. And I know I could speak for everybody on our panel here that we acknowledge and recognize the critical social issues that remain needing to be addressed. Each of our cities face a history of segregation and economic inequalities that all of us are aware of and eager to address. We acknowledge that digital tools and data are addressing this symptom of food insecurity, but we believe and hope that through this exploration, we can convene decision makers and inform the system overall around where need is and how we can best utilize both policy decisions eventually, but most importantly, system operation decisions for addressing community food security. So what we're going to do today is I'm going to just introduce sort of the overview of how this convening came together, talk a little bit about some themes in the digital world around food insecurity issues. And then each of the cities will talk about their work and what they've been able to do over the last while. We will leave some time for questions at the end because we're really interested to hear from all of you on how this resonates and if there are questions from you. We also will have a poll after my little introductory discussion because we're eager to understand if and how data is being used and digital tools might be used in your cities. So thanks. Why don't we go ahead to the introductions, please, Claire? So our panelists today, as mentioned, are from Austin, Texas, Cincinnati, Ohio, and Evanston, Illinois. It is through Minerva Delgado and Olivia here at the Hunger Free Communities that we all recognize the opportunity to convene these three different stories. We will hear from three different perspectives, all on the same systemic issue, so of food insecurity. So from Austin, Texas, we have Edwin Marty, the food policy manager in the Office of Sustainability from the city of Austin, and his colleague Clare Zutz, who's a doctoral student and in the Community and Regional Planning program at the University of Texas at Austin. And she's also a health portfolio contractor at the Dell Foundation, the Michael and Susan Dell Foundation. Charles Hoffman is our speaker today from Cincinnati, and he has been working as a senior data scientist with a data firm called 8451 that is part of the Kroger Corporation. And then from Evanston, we have myself as a project advisor, and then we have three wonderful students from the McCormick School of Engineering, all masters in science analytics candidates from Northwestern University. Adi Tyagi, Arya Wang, and Doris Cow. So that's our introduction. And why don't we move forward, and I will begin to talk a little bit about the themes we'd like to address. Across all of three cities, you'll see in action, one way or another, a collective impact approach. I hope that Baylor University is getting a lot of attention, not only today, but through this Hunger Free Communities work. They have really put together a wonderful collective impact toolkit focused specifically on hunger and food insecurity. They have a whole data lab, which I'm happy to share the link to. And I have had great conversation with Jeremy Everett, the director there, about how we could try and use some of the tools we'll talk about today in service of their collective impact approach. The next slide, please. The Rockefeller Foundation has just recently published a book, a paper called Reset the Table, where they have this very coherent and coordinated approach for addressing what they're calling nutrition insecurity. And their calls for unifying actors across sectors really implies collective impact. And their call to modernize data and tech platforms is really right up the alley of our instincts. So I just wanted to reinforce that there are funders of this caliber that are calling for the very work that these cities are doing. Next slide, please. Additionally, the Siegel Family Endowment has recently published a white paper that talks about the importance of civic infrastructure being built between physical, social, and digital investments, acknowledging that the physical and social are enabled and supported ever more so by digital information analytics and connections. And so these kinds of systems of support are the frame within which we're looking through our work. So please proceed to the next slide. So the thesis of this today is really around these 4 values of data and digital tool utilization. What if we could locate needs and map where food access and diet-related health data can indicate areas of hunger and nutrition insecurity? What if we could better calculate demand to support community food security partners and indicate demand? What if we could coordinate services across distribution partners with costs, capacities, and system effectiveness being indicated? And what if we could better measure the impact so that all stakeholders can better understand how food secure their community actually is and where additional investment might be needed? So this is really the intersection of where the 3 cities came together. And we will each show examples of how we've been trying to get toward this vision. Next slide. Over to Austin. Thanks so much.
Yeah, thanks so much. I appreciate it.
I think we're going to do the poll right now, Edwin. Sorry, I forgot about that.
Do it.
Here's a quick poll, everybody. There are 3 questions here, and what we're eager to do is understand from you these 3 questions. Mary, I'm not seeing them. Are they coming up for you?
Yes, it should be going. It should be a pop-up on your screen. And if it's not, in the bottom part of your Zoom screen, you might have an icon that says polling or a 3 dots that says see more, and then there might be a polling area. It looks like we have 1 person that voted, 2 people. Looks like some folks are showing now.
Great.
Oh, for some reason we got the poll closed. I'm going to relaunch it. And if you already voted, you'll have to go ahead and just vote again. So if you can go ahead and make sure that you don't end the poll, just, and I believe if you are a co-host, if you're a speaker or panelist, you may or may not be able to vote in this, just so you know.
That's what I'm seeing. Okay.
Great. We've got plenty of folks voting. Got about almost half voted. Maura, can you see the results as they come in?
I cannot.
Okay, that's all right. We're about 75% done here voting. So we're almost there. A few more folks. And we've got 2 more folks to vote, but I'm not sure if they're going to, so shall I end it now so we can see the results?
Yeah,
all right. Great. Now I'm going to share the results for everyone. Can everyone see that? Maura, can you see?
I do not get a visual. I'm sorry.
Aha. Okay.
If anybody on the team sees it and wants to read it out.
Yes, I can see it. Would you like me to read it out?
Sure, thanks, Adi.
So the first question is, what barriers do you face in getting data analytics and digital tools used in your food security programming? And a lot of the audience felt the major barrier they faced was organizational capability, with 60% of respondents voting for that. The second is, how accurate is your data around food insecurity rates? And an overwhelmingly large majority, 78%, responded medium. So their data is of medium accuracy. Something of note is that 13% noted inadequate data. That's something we'll definitely address in our presentation. The third is, which data sets are you relying on to understand food insecurity rates in your community? And there was a pretty even split here. 30% are evaluating SNAP data, 44% are using data from their local food bank and other local organizations, and 20% are using data from their local government. So this is something we'll also be addressing in our discussion moving forward. Thank you.
Thanks, Adi. That's great. All right. So thanks, everybody, for your input. We really appreciate your contribution there. Let's hear from Edwin on the work that they've accomplished in Austin. Over to you.
Thanks so much. I appreciate the opportunity to contribute to this important conversation. Again, I'm Edwin Marty. I'm the Food Policy Manager with the City of Austin's Office of Sustainability. I've been with the city about 6 years, working on helping provide a strategic direction for the City of Austin's work to develop a more equitable and sustainable food system. Just to start out by saying I appreciate the framing of this conversation. Data, I think, is a critical part of the conversation of understanding how to create a better food system. And data is a potentially problematic concept, needing to understand that who gets access to the data can sometimes drive the story behind the data. We try to use a phrase that says no stories without data and no data without stories. So we're going to share a little bit about the process that we've gone through pre-COVID to collect data around food insecurity, and display that and create a story around that, and then dive into very quickly the information that we've been working with during this pandemic. And then I'll turn it over to my colleague, Claire, to describe some of the additional work that she's been doing. So next slide. So about 3-4 years ago, we started a conversation with my colleague in Baltimore, Baltimore City, and colleagues at Johns Hopkins Center for Livable Future about how to get a better understanding of food insecurity in municipal areas, recognizing that the previous work, often called food deserts, left a lot to be desired. The framing of the conversation, just the use of the term food deserts, was problematic. And we felt like the extrapolated data that was available nationally didn't really accurately portray the picture of food insecurity and access to healthy, affordable food in our community. And so we liked what we saw out of Baltimore City and the Center for Livable Futures on a project they called the Food Environment Analysis. And so we were able to work closely with those partners and adapt that process for a local analysis. We hired a couple of data collectors and did extensive surveying of food retail locations as well as other food access points around our community. And we developed what you see here, this story map of food access in Austin, basically portraying where what we consider healthy food retail locations are, other food access locations like food pantries, community gardens, et cetera, farmers markets. And then we overlaid that food retail scoring, if you will, with demographic information around race, ethnicity of communities, median family income, access to transportation, et cetera, to create what we call these more or less community scores for barriers to access healthy, affordable food. Next slide. We also did some work with our peers at Austin Public Health around the social determinants of health, trying to understand not just how the information that showed the barriers for accessing healthy, affordable food looked, but also how that looked compared to health disparities. Austin is unfortunately well known for being a very segregated community in terms of economics. Is also along race ethnicity lines, generally speaking, east, west, divided by I-35 running down the middle of the city, divides more or less the white community to the communities of color. Traditionally, that was imposed by our traditional planning process of the city dating back to 1928. We're very aware of these issues and very concerned about, almost 100 years later, we're seeing ongoing health discrepancies based on that. No really other way to put it, but institutionalized racism is displayed through the planning process. So part of our effort in this food access analysis was to really get a accurate grip on that story, and then begin to start understanding how to unpack that story and what the best strategies would be for moving forward. Do we need to incentivize grocery stores in low access neighborhoods? Do we need to encourage other food access opportunities, community organizing, et cetera, et cetera. So that was kind of the impetus behind these maps. And then COVID hit. So next slide. We were aware roughly of sort of extrapolated food insecurity data, thanks to our partners at places like Feeding America. We were seeing decreasing food insecurity rates, paralleling the economic prosperity in the city of Austin, as well as the economic prosperity around the country from 2016 up to 2019. And then COVID hit, and we, like every other city in the country and the world, saw significant economic impacts due to the pandemic and the shelter-in-place orders, saw skyrocketing food insecurity rates. But we knew, unfortunately, that we already had significant food insecurity in our community. So what we were most interested in was how do we, in a fairly fast manner, get a grip on not only how is the economic impact of the pandemic affecting what we consider the current food insecure or the traditional food insecure communities, but who was this new food insecure community that was undoubtedly going to appear as a result of significant layoffs throughout our community. Next slide. So we worked closely with partners, primarily working through our Emergency Operations Center, in collaboration with lots of other groups and government organizations around the area, to get a grip on what this looked like. We fortunately were able to partner very closely with our United Way agency here in Austin and get data from the 211 call line regarding who was calling about food access. And we were able to utilize that information to create some pretty good maps and overlay that with other demographic information to try to get some kind of idea of what the pandemic was doing to food security rates and geographical issues around food access. We were also able to work with our United Way agency closely to bolster our connectatx.org site. So this basically is a parallel site to the 211 call line, providing up-to-date, literally daily updated information about where food pantries were located and hours of operation, other food access options. We were able to help get a map in place that did not previously exist, basically just using Google Maps to overlay all that information and keep it updated on a daily basis. So at the very minimum, we were very excited to be able to have up-to-date current information about locations for emergency food access that was both available via phone and internet and translatable into many, many different languages. All that said, we knew we were not really capturing the entire picture. We didn't really have a handle on basically the supply versus demand issue. So I felt like in some ways I was trying to drive with my eyes shut in terms of trying to make recommendations on what the city of Austin needed to do to address immediate food access issues throughout the city. We had vague ideas of sort of extrapolated need, but we didn't really, and still don't to this day, have a particularly accurate and reliable way to both assess current issues and then most importantly, to assess what's this going to look like in the next month, in the next couple of months, over the next year. So I'll turn it over to my colleague, Clare Zutz, to talk a little bit more about some of the stakeholder engagement work we've done. Thanks.
Great, thanks, Edwin. So I'm Clare Zutz. I'm a doctoral student at UT Austin. And in addition to what Edwin has mentioned, we were also really interested in the social structures and relational aspects of building civic infrastructure. And so interestingly enough, another thing from Baltimore, but so what you see in front of you is a diagram that the city of Baltimore created, and their goal was to clarify who was involved in emergency food response and what their roles were. And when we saw this, we thought it was really helpful to try to clarify those organizations and roles, but we wanted to turn it into a digital tool so it could have some additional functionality. And so what you see in front of you, which is a little blurry, is kind of our version of that diagram. And so what we did was we had a list of organizations and the roles that they were playing in the emergency food response during COVID. And we took that and created an online network map of those organizations and their roles. So obviously what you're seeing in front of you is just a screenshot of that. It's not the actual online platform, but we did use Kumu, which is a great website. It's free and really user-friendly. So I'd encourage everyone to check it out. But what it's allowing for is, you can see there's a search bar, there's Zoom functions, et cetera, and all the dots on there or nodes are different organizations. So you can search for organizations and find detailed information on them. And then there's also additional functionality. So at the bottom, you'll see this relational strength here. And what we did was use that to identify the relationships that the city had with different organizations and opportunities to strengthen it. So Edwin's office basically was in charge of leading the emergency food response during COVID. And so we really wanted to have a clear understanding of who is involved in this work and opportunities to really strengthen the network of emergency food response organizations, especially in light of the fact that we could have another pandemic as we had not foreseen this one. So thinking about what are the ways in which that we can use digital tools to better understand collaboration, information flows, et cetera. And so this is kind of a very, very short version of that, an intro to this, but we're really excited to build this out to help us understand how we can engage organizations better and have more clarity around roles and any redundancies in networks and collaboration. So now I will turn it over to Charles in Cincinnati.
Thanks, Claire. Thanks, Charles.
Hey, how's it going? I am really happy to present on this topic. I'm Charles Hoffman. I work for 8451, which is the data science and analytics arm of Kroger in Cincinnati. So if you would move to the next slide, please. We've had a previous partnership, especially with Cincinnati Children's Hospital and the city of Cincinnati, to just help look into different determinants of health within the city and try to map that at a neighborhood level to try to target policy towards some of the negative indicators of social health within the community. And that partnership led 8451 and Cincinnati Children's to brainstorm on ways as COVID started to spike that we could use data science and analytics to address some of the issues that pertain to COVID. In talking, we decided that child hunger would be a good area that we had the data and thought that we could make the best impact. So a local councilman got us an audience with everybody on this slide and quite a few others on a weekly basis to just talk about hunger within the city of Cincinnati. And the methodology that we developed with Children's was to try to identify gaps in the free food distribution network within the city. So when the city of Cincinnati Public Schools went to remote learning in response to COVID at the end of last school year, almost overnight, they had to really adjust the food distribution network, because while children were used to getting those 10 meals a week, up to 10 meals a week through the free and reduced meal program in the schools, that changed drastically with COVID, and they had less access to those programs. And if you're familiar with how much SNAP dollars cover as far as the total for weekly meals, there's a large gap there that is really filled by those school meals. So we wanted to make sure that there wasn't a geographical gap in relation to the new network that had been set up. So we got the data from all these different providers on the screen of where they had food sites that were serving 3 or more days a week, plus the Cincinnati Public Schools free food distribution sites that have been set up, to try to map those against the areas that had the highest child poverty and ensure that there weren't gaps in any of those high need areas. So if we could go to the next slide, please. So the same councilman was able to get us in front of that group of providers who would be able to make a difference by adding sites or flexing their resources. And we were able to present them with that initial gap analysis. Essentially what we did was we mapped the 1 mile walk areas around each of the food distribution sites that we had identified as consistent sources of distribution within the city. And we overlaid that on top of a base layer that showed child poverty within each of the census blocks in our Cincinnati neighborhoods. And where there wasn't green on top of red, that was a gap. And we identified those to the different organizations, and they really, really jumped onto that data and helped to fill those gaps. So we had some large ones in some of our higher need areas where they set up a site, and on the first day, they were serving 800 to 1,000 meals a day during the first week. And then also they used the underlying map data to target some of their larger events in the highest need areas of our city. Various other projects came out of this, just one-offs for some of these organizations where we might prioritize Spanish interpreters in areas with a higher Hispanic population. And all of that was possible just with the background demographic layers and the overlay of the coverage areas of our different sites that were servicing those populations. If we'll go to the next slide. So the map I showed above that has demographics and the sites that are available to serve them was made available to all of our stakeholders. It's just a publicly available map on one of Esri's websites. So I made that available to the food distribution partners, but we also have the issue of not all of those locations, similar to what Edwin was talking about, being mapped in a single source. So each of the different providers might have maps of their own locations, but we wanted to make sure that the public could go to one location and see what sites were closest to their home, get the times that they were open, what they were serving, who was eligible. And so we host a public facing website that gives information on all of those distribution sites, along with general COVID related information through one of Esri's site hosting applications. Because prior to this, I think that was one of the best things that came out of our networking with these different groups, was trying to look at this network as one cohesive unit, because they do all have their different goals, their different methodologies of getting food to the neediest populations in our city. And sometimes they're very much in silos looking at that. So bringing it all together and mapping that need as one cohesive community and trying to address it was a big output of this part of the workflow. And if we can go to the next slide, where we're continuing to work that initial workflow, we identified the geographical gaps to try to fill them in the short term and make sure that kids didn't have to walk more than a mile from the highest need areas to get the resources that they needed. But that doesn't necessarily mean that they were getting all the meals that they needed. It just means that they had access to one of these sites. Our continuing work with primarily the University of Louisville, University of Cincinnati, and Cincinnati Children's is to expand upon trying to analyze the meal gap within our communities. So the meals that are supplied versus the meal needs within that community. So that graph, I think, is a really good representation of just high level what we're trying to look at, all the different sources of meals within the city and how that maps up against the demand. And again, building on Edwin's point, part of that is trying to get to some of the leading indicators. So not just getting that point in time data from things like the census that can become stale over time, but trying to get leading indicators from sources like monthly SNAP data integrated into our workflow so that it is a scalable model where we can try to develop real-time solutions and policy to affect the areas that are in most need in our community. So that is the end of mine, and I will pass it on.
Thanks so much, Charles. Super helpful to hear your storyline as well as Claire and Edwin. I'm going to introduce Evanston, Illinois. Again, I'm Maura Shea. I'm project coordinator of our Everybody Eats project here in Evanston. And we will talk through, I think, beginning with Adi, how this project proceeded. Claire, if you could take us to the next slide.
So my name is Adi Tyagi. I'm a member of the core analytics team from Northwestern's McCormick School of Engineering. In presenting this slide, I want to start with why. A lot of the poll results indicated that people would like to see a template or data sets to use in their food insecurity efforts. And I'd like you to view this as a possible template to organize your analytics when it comes to addressing food security in your communities. So we started out by dividing our local food insecurity problem in Evanston into two distinct areas. The first was what I call macro level analytics, and that was addressed towards informing city policy of the city of Evanston. And the second was what I call micro level analytics, and that was more targeted towards individual NGOs and food security organizations operating within our community. Breaking it down further into two more levels, we broke down macro level analytics into two distinct factor sets, as we call them. The first is structural factors. And by structural factors, I mean factors that have always been in Evanston even before the advent of COVID-19. So in some way, they're structural or fundamental to Evanston. The second are COVID-19 factors, factors that soon came into focus after the advent of COVID-19 into our community. When it comes to structural factors, we identified the three top factors we identified were people of younger median age, higher CDC social vulnerabilities. The CDC social vulnerability is a index computed by the CDC that interestingly measures a community's resilience to natural disasters. And the third is lower computer access. So these three factors, what I call structural factors, are strongly associated with food insecurity within the Evanston community. The second are COVID-19 factors. COVID-19 factors are much more fast moving, more quickly or frequently updated, and they are especially relevant in the COVID-19 era, so the post-COVID era. In particular, so not receiving supplemental social security was one big factor we identified. Not being covered by any type of health insurance, surprisingly, also correlates with food insecurity, and being African American or Hispanic or elderly. Now I'd like to move on to the data sets we use, the constellation of data sets we use to inform our analysis. And I know there was a lot of interest in this. So to identify structural factors, we actually looked at Feeding America projections for food insecurity within our community, as well as this very interesting tool called Policy Map. Policy Map provides you with demographic and other geocoded information about your local community. When it comes to COVID-19 factors, here things got a little difficult, and we rose to the challenge by using first the COVID-19 Impact Survey, which is a survey conducted nationally by the NORC at the University of Chicago. We used SNAP distribution data as well, and we used free and reduced lunch data as well. Since these are fast-moving data sets that are updated frequently and critically were updated after the advent of COVID-19 into our community. Now moving on to the right part of the slide, the micro-level analytics, we partnered with an organization called Produce Mobile, which essentially receives food from a food bank upstream and then distributes it via mobile trucks to need areas within the Evanston community. And the form our analytics took in that effort or in that theater was organizational level forecasting. And we broke our analysis down into three big areas. The first was forecasting downstream community need. The second was forecasting upstream food bank supply. And the third was volunteer turnout, since Produce Mobile is heavily reliant on volunteer turnout to staff its missions and its distributions. When it comes to community need, we actually forecasted a rise in the number of individuals arriving at their distributions, paired up with a leveling of supply from their upstream partners, the Greater Chicago Food Depository, and at the same time, a drop in volunteer turnout. Now, this could be because of the impending winter or perhaps an increase in COVID-19. If you take this together, the actionable insight is that need is going up for our individual organization, for Produce Mobile, supply is staying level, and number of volunteers are dropping. So this indicates a potential danger point that the organization could plan for in advance. When it comes to database, I would like to really show Produce Mobile to be an exemplar when it comes to data collection. Data had been fastidiously collected over the past 4 years about the number of individuals served, the amount of food received, as well as the number of volunteers at each distribution. And it was this data that informed or enabled or empowered our forecasting to the future. So I hope I was able to give you a template that you can then apply to your own communities in analyzing food insecurity. I'd like to pass it on to Arya, my colleague, next.
Hi, this is Arya. I'm also a student from the Master of Science in Analytics program at Northwestern. So when we were working on this project and trying to understand the services that food providers in Evanston provide, we found that the food providers at Evanston do not work collectively as in a network. So food providers do not collaborate with each other, and they do not know how other providers are doing. Therefore, we were thinking about how we can help the food providers in Evanston work efficiently as in a network and make informed decisions of the overall more comprehensive situation. So in order for the city of Evanston and organizations in Evanston to better coordinate the whole provider system, we recommended this map tool that provides information on the food provider, on the food capacity of different food distributions. So here you can see on the right, an example of the map in which each dot represents a food distribution. Users should be able to see the location distribution of the food distributions and the current and maximum food capacity at the distribution. So this map would be helpful in that all distribution partners would be able to see what the whole system look like and how it behaves. And it provides up-to-date capacity tracking of the distribution partners, which allows transparency of the information in the network of providers. This map would also facilitate the exchange of information among food providers so that they can collectively provide a better and more efficient service to the community in need. Meanwhile, we also think that this tool will also be helpful in the purpose of tracking the impacts of the food providers and evaluating the investments. However, this is a map on the food supplier side without any input from the demand side. In other words, the community in need. Next, my teammate Doris will introduce a chatbot tool that can help better connect the food providers and the food insecure community.
Hi everyone, I'm Doris. Same as Arya and Adi, we are in the same program, Master of Science Analytics at Northwestern. This is the chatbot tool I built during this summer for Evanston. So the purpose of this chatbot tool is because I think one difficulty Evanston is facing right now is that people in need, they don't actually know what food resources are available for them. So with this chatbot tool, they can use this to find the best food services that serve their needs. The chatbot tool is built on Azure Q&A Maker. It's kind of like a Microsoft online tool. It follows a very simple decision tree hierarchical structure, start from a root question and depend on what the user input, it's gonna pop up the next question based on the answer for the previous one. It provides text-based chatbot to inform the food insecure neighbors about options. It's anonymous and direct to neighbor information, support the dignity and choices, a tailored recommendation based on the user input. So eventually you're gonna have this pop-up information box showing you the best choice currently in Evanston that serve your need. And it's gonna provide some detailed information about this choice, like what is the name of this provider, the contact information, the frequency of the food providing, and the location of it. So it's kind of like something that could be helpful for other communities, I guess.
Thank you, Doris. Great. If we could go one more. I have just so this is just a build, Claire. In doing all of this work at all these different levels of the Evanston food security group, it was clear through our collaboration across the city task force and through a collective impact initiative that being really human-centered can help us to provide the sort of cohesive unit that Charles was talking about, and that Clare and Edwin from Austin are also eager to build. So we were just wanting to map out what the roles and functions within this system look like. So Clare, if you could just build out each of the layers. The personal support is so critical for the food insecure neighbor, as Doris just shared. Where do I go? What do I need? How do I find it? That's a critical first rung of information. But the next one is also important. It's more generic information. These are people who are connected to the resources in the community and are a little bit more generic and comprehensive, but also another critical step. Thank you. The food distribution levels, these are the people who are really handing out the food, and holding their role distinct from the previous ones is really important to acknowledge. These are the people who are really great at supply chains and managing operations, but they also have a very clear function, whether they're a school or a hospital or a faith-based organization or a youth center. So these operational partners for food distribution, I think, need to be called out distinctly. And of course, funding of tax dollars and philanthropy are key. What's really important here, and what we discovered, is the next click, Claire. It's the connection between the food insecure neighbor and the community support partner. And when we're thinking about the demand signal, who is it in this system that actually can have their finger on the pulse of demand? And we hypothesize that it's this community support partner. These are the social workers in school districts. These are the folks who are handling the programming in youth centers and work directly with families. These are, of course, all the leaders in the food pantries, soup kitchens, and homeless shelters, but they're also the folks who are coordinating on digital tools currently, like mutual aid societies who are organizing around Facebook groups, etc. The library, the city services, 211 or 311, are all, they know who knows who's in need in the community. And so how can we really lift up those community support partners? And most importantly, the close trusting relationship that our food insecure neighbors have with those individuals. And then what role can they provide to this system so that we can have greater privacy and protection and transparency for our neighbors? And that's really critical to underscore. So I'm just going to restate it. When I was talking to the social workers in the school district, they would talk so protectively and appropriately so of the folks that they were serving. And so it was that insight that we really wanted to think through. How can demand signals be best placed and within the workflow, of course, of these individuals? Next slide, please. So what we just prototyped, again, it's a hypothesis, is that having a dashboard of the demand could integrate this way of seeing what is needed for the system. So it not only sets expectations for what the system needs to serve, but it can potentially start to actually break down into different segments, who's needing what kind of food. In our task force, there's an ongoing discussion about the importance of prepared meals versus groceries. If those community support partners could be the conduit through which those decisions are made, and the negotiator, the certifier, the endorsement of those decisions, that would be a critically valuable perspective. And then allow an understanding of how much of the capacity that Arya was talking about is actually being tapped, and how much more might be needed. And that can give a direct influence, a direct set of information to the funders, so that are supporting the system. So I hope that what's been clear in all of these presentations is the many layers that are at play, but how distinct data and digital tools can be supporting each of them. I think by calling out those different layers in the system, we can really understand the right kind of tools that are needed, how usable they could be. Of course, simplicity is critical, but like Adi was talking about, for us, seeing how Produce Mobile was able to collect very reliably over the years, what is the zip code and the number of people that are coming from that zip code, data is feasible. So data collection. I think that's our last slide from Evanston, and we just have a summary next. Is that right, Claire? Yeah. So we're going to transition over to questions and answers here for the last few minutes. But again, just want to reiterate the importance of how digital tools, as they increasingly become part of the social sector, are thought of as part of our social systems, physical, social, and digital. Mary, I'm going to open it up for questions now. If you do have a question, please enter it in the chat. We'd love to keep some minutes here for folks, whether they're technical questions like Kenna Rogers was asking earlier about the kumu.io site that Claire was talking about, or if they're more theoretical questions or structural questions, we're happy to answer them. We welcome your questions. I think Mary said if you put a Q in front of it or a question mark, that would be helpful.
We've got a question that's come in. Can you see it there in the chat, Maura?
Yes, thanks. So this was a question of, was the Evanston map made with Tableau? Who from Northwestern would like to talk about the Evanston map? Doris, would you like to? Or
sure.
Aria?
The map is actually built with Kepler.gl, which is a kind of online visualization tool implemented by Uber. We just tap it in the chatbot.
Thank you, Doris.
No worries.
What other questions do we have from the audience? I'm also happy to ask questions of you all and how resonant some of these points are about building civic, social, digital infrastructure, and if that's something that is important in your work and something you're discussing. Okay, here we have a question. Thoughts or incentives for organizations to share their data? Yes, exactly. Thank you, Jen. See, right. As a program manager, I spend more time serving than analyzing service data, but would get more time to play with data if there were funds directly linked to that time. Exactly. Does Charles or Edwin or Claire, would you like to talk about that? Incentives for organizations to share data? What about you, Charles?
Yeah, I think overall, just when we think about scalable solutions, it would be very helpful to have consistent data from some of the big players like Feeding America and those national networks. And if we had those locations and their general output in terms of pounds or meals, it would help us to really look at supply in a scalable way. That's some of the area that I'm trying to work with Esri to get feeds like that. But as far as incentivizing that sharing of data, it's allowing them to then have use of certain layers from Esri like that and like real-time snap data. So if they're inputting the data, then they get the end result of it as well.
Yeah, I'd like to speak to that as well. The City of Austin has an open data portal, and we're trying our best to get as much of the sort of information that the city tracks up onto our open data portal, specifically so that it can be used by other organizations and sort of just create a community platform for that data. But food systems is tricky. You know, a lot of other sectors are doing this pretty effectively. But there's so much, you know, the private sector doesn't want to share data, especially around SNAP. Like food retailers are very uninterested in sharing that because it's proprietary information. So I think figuring out how to use a municipal government as a leverage point might be a really good solution. It's certainly something that we're playing with, is how do we sort of say, this is the kind of stuff that we're looking for. We're not trying to unpack the data and get into the gory details, but we just need rolled up information. We're so far from that right now in our community, and I haven't seen great examples from other communities either, but I think it's a great question and something that we need to spend a lot more time looking at and need honestly, I think the philanthropic community could go a long way to saying, if we're going to give you money to do stuff, we're going to need to get some level of data back that we're then going to share in an aggregated way with others.
So Rockefeller Foundation has recently co-sponsored with MasterCard a new organization called data.org, which is trying to address the sort of public sector silos and proprietary nature that Edwin was talking about. And so I think the fact that they're also calling for integrated solutions is a real invitation to address these kinds of issues around data with a major funder like Rockefeller. Another question here from Christian is, have you run into any issues regarding coordination between intergovernmental components? Our main food insecurity organization is county-wide. I know that that's something that is a real concern around different intergovernmental layers and levels and who's responsible for what. Edwin, maybe you could talk to that first.
Yeah, I mean, the city of Austin is inside Travis County, but it's also inside 2 other counties. And we've got 8 school districts in Texas. School districts are completely separate. They're called independent school districts. So from a data perspective, just from the governmental side, as a food policy manager for the city of Austin, I'm working within 3 counties and 8 school districts. It's just, I mean, to say bonkers would be the simplest way to put it. And just to try to tell a story about what does food security look like in Austin, all of a sudden instantly becomes, and how do you define Austin? I'm places like Baltimore that have sort of the, city, county, school district all stacked on top of each other. I don't know that that's the end solution, but it's a major issue. And I think in the food security world, we still lack a way to articulate what's the footprint of the community that we're really wanting to look at. In the environmental world, they have there's this concept called the watershed. And so that term has been extrapolated into the food system world to say the food shed. And I think, unfortunately, it's pretty impractical and inaccurate to call something a food shed because we live in a global food system. 50% of all the food that we consume in America comes from another country. But there is maybe a way to think about food shed and food insecurity in a similar way. So that we can get that geographical footprint and then create, honestly, there just needs to be really good examples of intergovernmental contracts and roles and responsibility between governmental organizations. I think the main lesson learned for us in the pandemic has been we don't have very clearly defined roles and responsibilities in between governmental organizations like school districts and counties, et cetera, and municipal governments around who's responsible for what, in what different kind of situation. I'm hoping that one of the things that comes out of this pandemic is a much better focus on that, so that, as Claire touched on, when the next pandemic, not if, but when the next pandemic hits, we'll be in a much better place to respond.
Charles, do you want to quickly chime in about that, or is that not as much of an issue for you?
I think our primary concern around intergovernmental things during the pandemic has been when decisions are made at a high level that really affect the overall food insecurity situation nationally, and aren't made with respect to those downstream effects. So, for example, the summer feeding program is a really large program, probably one of second or third behind SNAP and school meal programs, that allows kids to get fed during the summer when they don't have as much access to the standard school feeding sites, and it does that through reimbursement programs. A lot of waivers were approved to make that effective during the summer with the pandemic. And then at the end of the summer, when schools were going back into remote learning, once that district went back to remote learning, those waivers went away and the summer feeding program was ended. So we had about a 2-week period where those waivers weren't extended, but kids were back in remote learning. And if you look at the meal totals for remote learning, they're extremely low because of the access barriers that exist. And luckily, Secretary Perdue did extend those waivers through 2021 after both sides of Congress pushed for that and multiple institutions pushed for that. But I ran a lot of numbers just locally in Cincinnati and Kentucky and nationally to contact some of our representatives. And pretty staggering the effect that that has, even on a 1-week level, when we don't extend the programs that are helping deal with the pandemic.
Thank you, Charles. That's very helpful. I'm just going to slide one last question in here about tracking individual clients. Understanding where meal gaps exist on this per zip code can be difficult, and people travel to various agency partners in multiple zip codes. And the question is, has anyone come up with ideas on how to more accurately track clients? I was excited to jump into this opportunity with the Evanston team because I have been for the last 4 years working at Feeding America, leading the innovation work there. And what we have seen is that folks are really working hard to get the food they need. And if they're going to multiple agencies, it's often because they need the food. One analogous example that we've been interested in looking at is homelessness and how the coordinated care model works there. And I believe there's something quite similar that could be applied to food insecurity, where there's a coordinated entry point where each individual is cared for and tailored to at an individual level. I think that's a really interesting model that we should consider as a sector for food insecurity as well. I'm getting very gently prompted by Mary to let her wrap up our event here. I just want to really thank everybody for sharing their insights and really great work today. It's really been a pleasure to share this work with you all. Over to you, Mary.
All right, thank you so much. A huge thank you to all of our speakers today, sharing your expertise with us. Very valuable information. You can keep the conversation going on this session if you'd like in the Whova app. You can just navigate there by clicking View Session, and there's a Q&A and a chat area there. So if you all want to head over there to keep the conversation going, you can do so. Coming up next is a panel discussion focused on how corporations respond to hunger during COVID. Looking forward to seeing you there. Thanks, everyone. All right. Thank you so much, all the speakers. Appreciate it. Bye.